All right, thank you for staying with Daybreak. Keep your views coming at Trevor Mbija at Citizen TV Kenya, #Daybreak. We are using this as a conversation to see how the county can plug in during this third wave of COVID-19, and there seems to be a bit of nuts and bolts there that we are stuck on. But Mbija, from an economic perspective, what would be the best remedy now? Because there's no cash flow. People have lost their jobs. The governors don't seem to be having money. In fact, the governor just told us that he's not been given money for January, February, March, April. Those are 4 months. What is the solution from here? How do we spur the economic growth? Do we send money to people? What happens?
Trevor, that's a heavy question. I feel like I need to be at the helm of the country to be able to answer that. So I'll just answer it as a layperson, just from where I stand.
Yeah.
I think the conversation that we've just had with Dr. Hillary, it does sound that the way the structure of cash disbursements in this economy is, it's a bit of a hard space where you're doomed if you do, you're doomed if you don't, because you sort of have to wait for the national government to be able to disperse, which tells me that the county operations, your operations and my operations are not separate from where the national economy is at. So today the national economy is in a space where it is constantly out looking for debt, whether locally or globally, because there is a deficit. And because of that deficit, I can understand the intricacies in terms of cash disbursement.
Yeah.
I think based on the way the Constitution is written, I am not a constitutional expert, we are left with a situation where Dr. Hillary just has to find a way to use his charm to be able to motivate and inspire at the county level.
Yeah.
I know he cannot be able to engage with the businesses at the county level to be able to come and say, give us your money, because as he has explained, I think when we were on break, the money has to come to the national government before it comes back. But he had mentioned earlier the element of being able to pass incentives in the form of taxes, either it's lower taxes or incentives that actually allow businesses to be able to transact with the county. I would look at it and say, if you want to be able to have cash inflows or at least cash circulating or business circulating, if I was a business in some of these counties, I think there's an opportunity to engage with the decision makers, starting with the county, the people at the county level, the governor, as well as the senators, who are able to come and now bring the prayers of the county people to the national government. And in a way have sort of a CAPSA at the county level that says, we can be able to engage with you. If I sell goods to you, can I actually get that incentive at the onset? So we find a way, if I'm going to do X, can I get this benefit of Y?
Yeah.
If, for instance, this is a medical facility that you have put up and there are spaces there, can I be able to put up ancillary services there, not get to pay rent, because you can't be able to pay me immediately, so I don't pay rent, but then I can use that space to be able to extend services to people there. So I think there's an element of charm and then there's an element of innovation, but I still keep coming back to the context of pause, reflect, and reprioritize. I think at a political level today, we're all gaining and gearing towards BBI and an election in the next year. So our request is for these people who are in these places of influence and decision, they have already seen the issues there. So there is an element of them coming back to the BBI and making those amends, because I haven't had some of these amends in terms of the revenue share and the structure of inflow and outflow of funds into the counties, as well as from the national government down and up. There has to be that level of accountability. My final point would be this. Either you can keep focusing on what the likes of Dr. Hillary have done or have not done, or you can remember that our country has 50 million people, give or take, who still have to find a way to fend for themselves. So whether you're in business or if you are running a business or you are employed, the question is, with COVID-19, what does this mean for me? I think for businesses, whether you are a business owner, an entrepreneur, or whether you are employed or not, truly this has been a time where God has said everything has just come to a standstill. So you can either continue in the old way, or you can actually ask yourself, how can I actually begin to engage differently? Technology has been such an enabler, and I think as we keep talking about procurement plans, whether at a national or at a county level, I think there is a responsibility and an award that these decision makers can give by saying, why don't we actually become very proactive, intentional about engaging these businesses with the idea idea of helping them reprioritize and identify where the demand is coming from. And if we begin to work with them, we'll help them have different ways of doing things, connect them to the government and the resources that they need. And maybe in 3, 4, 5 years, the structure of the Kenyan economy will be very different if we're able to engage in that perspective.
It makes sense when you talk about the reamendments of the BBI, but again, we are back to the bureaucracy that sometimes supersedes even common sense. At this particular point, the main point of the bone of contention is, can they actually even amend it? It's supposed to be salutary. They're not supposed to change a comma, full stop, nothing.
I hear you. But what I'm going to say is this. I'm not in that space. But what I do know is when we needed to amend the ceiling of the debt levels for Kenya, it was very quick for people to get the numbers at Parliament to be able to execute. So today, if we're in a space where we're saying governors and people at the Senate are in this space and this is what they want, I'm not in that space, but they understand what needs to happen. Because it's a matter of a decision needs to be made. This decision has to be made in Parliament. When he talks about the procurement plan and he cannot do anything out of that, it's a matter of, can we get one additional line to be able to help us to manage through this crisis? So I'm saying there's a whole level of integration and intricacies that are there. I'm not saying it's impossible. I'm saying it's possible, but it's something that needs to be a bit tactical and strategic. That I think I'll leave to Dr. Hillary. I'm not a politician. I might be way over my head, but I think it is absolutely possible.
Sylvia, you know, one other thing that I'm wondering, and I keep coming to you in terms of Senate because you're the one representing them as the oversight body, as just the same way Dr. Barchok is representing the Council of Governors and is taking the heat and praises at the same time. On your side, how come you haven't pushed for counties to be effective? You know now, January, February, March, April, they've not received their money, and the Senate hasn't said much. I've had a few people here and there speaking, but they're not as pushy as when it comes to misuse of funds in counties. At that point, all your voices are up. Now, when they've not received their money, I'm not hearing the same oomph, so to speak.
I think the oomph is probably because the House is not yet sitting. We're on recess, and also because of COVID protocols, we have cut off all the, physical sittings, and probably that is why. But at committee level, I can assure you, we've been engaging the Ministry of Finance, Treasury, that is, and a few other ministries to understand really what is the issue. That is a work ongoing at committee level. Our committees are still as robust, although we are handling our matters online. But we are asking these questions. These questions are definitely coming up, and not just disbursements to the counties. We're asking about people are not being paid, for work being done. A lot of debt towards the public sector who give business to the counties. They are not being paid, and that is a big issue for Kenya. And you see, these are now the post-COVID interventions that we were expecting that the national government would support is, to pay the old debts. And this is still outstanding up to now. And this is a question that is being handled at various levels in the committees and by different committees. So I can assure you, Trevor, this question is of close to our hearts because, if the counties are stifled of money, then it's Kenyans who are really suffering because all the devolved functions are at the very heart of Kenyans' everyday life. So these are questions that are being asked at every level of committee. That one I can assure you without a doubt. And even when we resume House, I'm sure it will be the first order of business on the floor of the House. You will definitely hear about it. I can guarantee you that. But let me just comment on something that our economist in the House has said as a way of moving forward. The creativity and innovation that is required by leadership at a time of crisis like now cannot be understated at all. And when we started doing the COVID rounds, when we were the ad hoc committee, we're impressed by some of the counties when we went and found that even before they had received the money, they had come up with all sorts of, plans and interventions, and especially partnerships with private sector, partnerships with community-based organizations, and partnerships with NGOs. And such things helped them move forward. So when it came to, say, the time when the government insisted that you have to have isolation centers and beds of up to maybe 300 beds or something like that, you found that there are some counties that had planned ahead with their stakeholders, with their key stakeholders that they had mapped and put together in a form of committee. You'd find that they had already mapped the need for isolation centers will be required, and therefore this is how we should handle isolation centers. And they would talk to a key stakeholder and say, we can use your facility. It already has 300 beds. Maybe it's a university or a hostel, and they would clean it up, and they would use that as an isolation center when it came, and then help them manage with funds. Such levels of creativity are critical. And the other question we always ask at Senate is, what happens with on-source revenue by the governors and the counties? What happens to on-source revenue? On-source revenue is an issue that senators cannot oversight because it's not there in the Constitution. And it is our hope, of course, when BBI passes, because BBI has put that in as part of what senators can oversight. We want to see also what on-source revenue is being used for. And more importantly, we want to see counties upscaling their on-source revenue, because, you know, with time now, 10 years into devolution, going on now to the next electoral cycle, by now we should have known the capacities of our counties. We should know where then counties can make their own revenues, more and more increased revenues. There are some counties that should really be making their own money significantly, because these are the things, you know, we want to see in future, such that even if the national government delays disbursements, then counties have some sorts of revenue then they can fall back on for the more critical items like, paying your healthcare workers salaries and, remunerations, and things like that. Okay. So this sort of creativity and innovation is really being called for by our leadership going forward, as opposed to, I cannot work without money. Yeah. We want to hear, let's plan as even we wait for the money, and what other interventions can we have as we wait for the money, or what should we do then when the money lands, then we can now begin to roll out, something that has been put into place. So these are sort of conversations we must continue having as citizens.
Governor, what do you do with on-source revenue? I see you scratching your head there, because I'm thinking you're probably wondering, this creativity is what is landing you in trouble to begin with.
Okay, thank you very much, Trevor. And I'm happy at least Silva is acknowledging that there was some planning that did take place. Even before the month of June. We had a lot of discussions, even we resource mobilized. And we are, like in Bomet, we talked to the multinational who supported us in ensuring that we have some of the PPEs that we used at the time. Yeah. Part of the money that we used actually in supporting the needy in the community actually came from a business community in Bomet. Yeah. So there's a lot of discussion, and a lot of support came from the community and well-wishers. Yes. Sylvia has mentioned the story of the on-source revenue. And Trevor, let me tell you, if I was able to collect all our on-source revenue in 1 month, that will only serve as, for the whole year, that will only serve as salary for 1 month. So 1 month.
After a whole year of collection?
After a whole year of collection, will only serve as salary for 1 month. So we still have a lot of work to do. And like in Bomet, from what some economists did for us, the maximum we can collect from all the revenue streams is 500, 600 million. At the moment, we are collecting half of that, around 250 million.
In a month?
In a month.
Okay.
My salary ranges from 200 million to 210 per month. So if I'm collecting 250, so you can see, even if I was to collect that in 1 month, I will service salary for 1 month. The rest, 11 months, where will I get money if I don't get disbursement and support from the national government? So that is a challenge that we are facing. And I think this is the story all over, except for some counties that are endowed with resources. If we talk, for example, Narok, where they have generated a lot of money from the national parks or game reserves, maybe they would be able to at least be cushioned in some way, because once the money comes to the central revenue collecting account, they can still use it back in their counties to pay and service salaries. Otherwise, for most of our counties, the story of own source revenue is still a challenge, and I think we still have a lot of work to do as county executives so that we can expand the revenue streams and ensure that we also minimize on the leakages that we have, because I think we also have a problem. We need to acknowledge that. We still have a lot of leakages within the system, and in gov't we are trying to minimize the contact between the physical money and the people through the process of automation, so that when you are procuring for a service from the government, you pay direct online, so that we reduce that people interacting with money, because that is one way of encouraging people to at least keep some change in their pockets, and then maybe give a fraction of that to the government. So we still have a challenge. But I want to also agree with Mwema. I think we have to be honest in the way we deal with the public, and how we use the public money, and how we put the interests of the public first. I think there's a lot of dishonesty in our country, and I have to, as a politician, I think as much as people would want to accuse me as a governor, but from where I sit, I can see a lot of dishonesty. And even from media, you can also see a lot of dishonesty. And I can tell you, Trevor, come the month of June, the end of the month of June, you will see another headline. Governors have not been able to spend money in their counties. How can I spend money that have not been given? If that is not dishonest, what is it, Trevor? Surely. I've not been given money. At the end of the day, I'm being accused that I'm not spending money. There is another special audit that is coming. We'll given a notice. And I think Silva has mentioned that, the issue of pending bills. So we are coming to be audited on the steps that we have taken as counties, the attempts that we have made as counties in terms of ensuring that we pay pending bills. Now, if I'm in arrears in 4 months, how will I pay pending bills? And we are closing the year in June. I will not be able to service the bills for this year. They will roll over to next year, adding to the pending bills that are already existing. And I'm now being accused I'm not paying bills as a governor. I cannot sell my cows to go and pay. I have to be given money to be able to facilitate that process of paying pending bills. So I agree, we have to be honest with ourselves. And we need to understand the environment that we are operating on. And that is why I'm totally in agreement that we need to look at our laws. Are we so rigid in some ways so that our steps are very slow in terms of ensuring that we pay or we deliver some services to an ANG? What is this that is preventing us from being efficient government? And when I talk of government, the national and the county. You can also see a lot of borrowing that is being done, especially in terms of supporting the fight against COVID. But the money is coming to the national government, but the fight is in the county governments. So you borrow, the money does not get to us. In fact, from last year, the month of June, the money that has come to us is that 115 million to support the counties. Otherwise, we have been surviving in our allocation in terms of ensuring that we have medicine in our facilities. So where is this money going to? Is it supporting the national referral hospitals that we have? And these are billions. And we are struggling as counties. And that is where we have the real fight against COVID-19. So you borrow, the money remains in Nairobi. We struggle as counties. We have to kill projects so that we ensure that we have medicine in our facilities. Then you'll be audited. So that's why I'm saying we need to be honest and we need to understand the environment that we are operating in.
But Governor, speaking of efficiency, you have more than enough oxygen at Longisa Referral Hospital, right?
Yes.
How come you're not able to even help the others who are complaining? What's going on there?
Now, Trevor, I think I will also accuse you of being dishonest. Because I think 3 weeks ago or a month, I was even live in Citizen telling my neighbors and the entire country that we have a lot of oxygen that we are producing in Longisa. And we are willing to support any facility that has run short of oxygen, even the ambulances that are on transit. So long as they have containers and they have run short of oxygen, they can drop by Longisa and will be able to fill those containers. So I appeal to my neighbors, especially Narok, Kericho, even Kisii, and even Nakuru, because we have a lot of oxygen in Longisa Referral Hospital. We have a plan where we are generating around 9,000 liters per hour. And that is excess. And by the way, Longisa Referral Hospital, all the beds in that facility are connected to oxygen, piped. We were able to put up the first facility in 2014, a small one. But when we came in 2019, we expanded that facility, so we have 2 compressors. In fact, one is on standby, the smaller one, in case we have breakages in the larger one. So we can always ensure that we have 24/7 supply of oxygen because we have 2 compressors, one on standby, the other one operating. So out of that announcement, we have been able to support a number of private facilities, even in Kericho. For example, Sloam has been benefiting from our oxygen plant in Bomet. Like last week, they came with 40 cylinders, and we were able to fill. Last week, part 1, they came with 20. We were able to fill. The only thing that we need is, we're saying now that we're giving you oxygen free of charge, and this is a private facility, we need to have an MOU so that you don't go and sell the same to the patient. We've given you free, so you should find ways of subsidizing that cost. That goes to the bill that goes to the patient, so that there is value for money, because I've done the investment as a government of Bomet. And what we want to do at the end of the day is to save lives. So in all our isolation centers, the 300-bed capacity isolation centers, we have quite a number. We have one in Longisa, a small one. We have another one in a private hospital run by a mission in Kaplong. And we have the main one in our sub-county hospital that is in Koyua. All these facilities have piped oxygen. So the main plant is in Longisa, but we supply Koyua, Kablong, and Tenmek also. We have an isolation, but they also have a plant for generating oxygen. So it's a smaller one. So in Bomet we have one in a mission hospital, Tenmek, and the main one that we have is in Longisa Referral Hospital. So, and this is out of the money that we've been given. So, and that's why I was saying, as the CEO of Bomet, I can say the people of Bomet have value for their money. Beyond the oxygen plant, we also have a suction pump that is attached. It goes as like a package within that plant. So where you can suck the fluid in case there is congestion and so forth. And we have connected that to every bed that we have in our referral hospital and even the isolation center that we have in Longisa. So we have a lot of oxygen, and that's why I'm appealing to my neighbors, in case you want, just bring the containers. At the moment, we are not using that. In fact, somebody was giving me the figures in terms of what the Kenyatta National Hospital requires and what we are producing per hour. So if we were to supply Kenyatta National Hospital, we'll still have a surplus of 1,000 liters per hour from that plant. So you can supply KNH on KNH and still have a surplus of 1,000 liters per every hour. So,
but what is the problem? Why can't they just come and take these things? Because
I'm wondering, why can it be sold?
Am I the one who's crazy here? Because I'm thinking they have more than enough oxygen. Complaining about not having oxygen. Why is it so difficult for people to go and pick oxygen from Bomet? I was going to ask Dr. Hillary, can it be sold, or would that be going against?
As much as we would want to say, but remember, we have this challenge, and that is why we are offering that we give them free charge.
Okay.
Yeah, and that's why I singled out Siloam, and I think we need to have an MOU so that they don't go and sell. Because we have given them free of charge, then they should also give it free to the patients.
So you're willing to give this for free?
For free.
As long as they also give it for free to patients?
For free to the patients.
Is that the reason why they don't want to come for it?
I don't know.
Yeah, but, people always looking to profiteer here because...
yeah, maybe the other challenge that they have is the containers. You had the other week or 3 weeks ago, the CS appealing for people to ensure that they return the cylinders, the containers. Maybe the packaging is the issue.
Is the issue.
That's why they are not coming forward.
Yeah.
And then the other challenge that we have in most of our facilities, there is no piping for oxygen. You know, it will be useless. You have a container full of oxygen, and there is no piping works within the facility. It will not function.
Okay.
So I think that could be also a problem that we have in most of our facilities. Even when you go to most of our referral hospitals in the counties, they don't have that piping.
Okay.
Yeah, so that could be a challenge that we have.
Yeah.
And there is a proposal that, and there is some money that has been set aside by the Ministry of Health to support counties to put up oxygen plants. The only thing and the only complaint that we have now, like in Bomed, if people are waiting, sitting back to wait for national government to support them, and then some of us who have invested, we are not supported, then we are not comfortable with that. I should also be given money to do something else.
Yeah.
Because I have sacrificed to put up this plan.
Yeah.
So if I'm sacrificing, denying myself money that would have gone to another area of development to put up a plan, and then tomorrow I'm not supported, then I'm not very happy with that.
Okay.
So I need to be given money,
maybe
expand my facility, or do something else that we need to do within Bomed.
Okay.
Well, otherwise, I think a number of counties, 11 or 17, are being supported to put up oxygen plants.
Okay.
Yeah.
I'll come to you in just a bit. Let me bring in Sylvia on this. Sylvia, this almost reminds me of the medical equipment scheme scandal now. Because you see, Bomed says they have more than enough oxygen, they can supply to everybody else, but they're just left there with their oxygen, and yet we're complaining that there's not enough oxygen around.
Oh, Trevor, these are the challenging issues that leave us, I think all of us, even like you have said there, a bit perplexed. Because what really then is the challenge? If Bomed could do it, why didn't the others do it, those who haven't done? And why is it now that it is required that they be given money, you know, to do it? And I think this is where it is important for us to do these audits so that we can really know what happened with the monies that were given to them. And, you know, something again, and the economist mentioned there, the reprioritizing of issues and, you know, development projects so that we can support the fight against COVID. It comes again now to the fore. You see, the interventions that the governor is talking about that he has done are for posterity. And what he has done for the people of Bomet will go a long way, because a healthy population then means they can work and be productive citizens in the country. So like I keep saying, if we had planned and prioritized as a nation on this issue of COVID, it would have been an investment for the future. It would have been an investment for the future, would have expanded our healthcare system, because we have reprioritized everything to fight, to fight COVID. And by the time 3/4 or half the population has been vaccinated, and therefore then we can now begin to say we are becoming safe, and therefore now we can look to other areas that probably had been left behind, or we had moved funds around, then you can say we have really expanded our healthcare system. And it's a good thing. It's a good thing that Kenyans can access healthcare properly, right from level 1 and level 2. So, for me, Trevor, these are really the conversations that sometimes leave you feeling a bit finished, so to speak. That there are some few Kenyans who want to take advantage of such, a pandemic to enrich themselves. It's terrible. It's a terrible thing, and I cannot wrap my head around it. And what I just want to say to the governor, you prioritized, you've done as much as you have done. and kudos to you and to the people who elected you, and that's how it's supposed to be. And truly speaking, if we think about it very critically, healthcare should always be number one, because what's the point of providing Kenyans with all other development issues when their own healthcare is not good? You know, Trevor, is like when I talk about mental health. If you're not well mentally, if you're not well physically, then how will you work? Even if you had the best road network system, how will it be of use to you when you cannot work because you're not healthy? So for me, healthcare is critical. It was such a privilege, serving in the ad hoc committee, because I got to see a spectrum of the healthcare system, in the country. And for those counties that have been able to utilize their funds accordingly, I can assure you that impact is definitely being felt even as we speak. But then other things that, we have to bring to the fore, Trevor, as we talk about how to move forward with the COVID situation, is enforcement. Our rural folk, out there in the counties, a lot of them are, very casual around it. In fact, you just need to go to a market day. Even as you're driving past, a county to another county, you just look at the market days and you'll see it's like there's no COVID that exists in the marketplaces. And therefore, we have to now call again to the governors. The least we can do, the small interventions we can do are, simple enforcement measures that our markets have to be organized in such a way that, we can ensure a bit of social distancing, and the cleaning and the washing of hands can happen in the marketplaces. There are some counties, actually, you go to the markets and you cannot enter the marketplace without washing your hands.
Yeah.
And their stalls, are organized such that there's at least some semblance of social distance. And that, that communication has to be constant. That conversation of let us wash our hands, let us keep social distancing must be a constant. Let us wear masks, but where we can't afford our masks, can we at least social distance? Must be an ongoing conversation in the least and in the minimum. Yep. So when you drive through the counties and you find that the markets, there's nobody, bothering about social distance or washing hands or anything else, then you begin to worry, because the idea we are trying to do is not to have the healthcare system, reach to a level point where it's, at collapse level.
Yeah.
So these conversations must continue even in the rural areas, because they're still very, very relaxed when it comes to the COVID protocols, Trevor.
Mwema, what would you recommend to counties now that we are in this situation? Because I've seen some of them waive some tax levies here and there, but even if you waive a tax levy and I don't have business, it doesn't help me much, right? I've closed down shop, so even if you waive that tax for me,
it really doesn't
help me much.
Okay. Let me take a step back, Trevor, as I answer this, and just a minor correction. Mwema is my father's name. My name is Bithe.
So you prefer to be Bithe?
Bithe, because when you say Mwema, you're probably calling my senior, but my name is... It's okay. It's okay. Just a minor correction there.
Yeah.
So, as I was saying, I like the conversation that Mheshimiwa Sylvia and Dr. Hilary are bringing on board.
Yeah.
We are all in agreement saying that debt is a problem. They're the people who have greater access to the corridors of power and the decision makers. What I would say is this: if debt is going to be taken, and we have been seeing an onset of this, we take debt to pay existing debt. Why not require that as the debt is being procured, as additional debt is being procured, allocate part of that debt directly to pay those people who've provided services to the government? It's extremely unfair to have a situation where the government does not pay people for work done, whether they are employed by the government or whether they have provided services to the government. And what that does is that it trickles down to the private sector, where we have the norm has become doing business in Kenya. You do business, provide services, provide goods, you're not paid. So what I would say is we can either go back and forth and say debt is a bad thing, but I think how I'd like to extend that conversation is to say, if you're going to procure this debt, we want an allocation of that debt to go to people who need to be paid. So it's no longer a conversation of debt is only used to prioritize existing debt holders. We as Kenyans need to also be prioritized. And I don't want to get into the spirit of whether debt is good or bad. We are already in that space. Let that debt then be directly allocated to the people who need to be paid. At least that will ensure that money is going through. And we need to get over this conversation of he said, she said, the bill says, the bill does not say, where you sit in a table and say, kama utachukua deni, Hiyo deni unapochukua X% inaenda kulipa sio kesho kutwa, today. So that we don't have the instances where people are actually working in government, in the case of the Bomet County and other counties, they're not being paid, or you don't have people who are providing services and they're not being paid. I think a second thing that I'd like to speak to in terms of what next, I like the graphics that I'm seeing here on the walls of Citizen. It's the coronavirus with the Kenyan flag there. And it's just showing us that it's not just a medical virus, there's also a moral virus that this situation has come to show us. Now, when the over 50 million or however many people went to vote the last time, I think it wasn't the entire population, but those of the people who went to vote were actually saying that the people we are voting for are a representation of who we are as a people. Leadership is always representative of the people that it represents. Now, with COVID-19, the people who have been represented have actually had to cut back extensively on costs. Not because they want to or because it's because it's necessary. You're talking about businesses that are closing shop. Now, for us to have our leaders who don't consider the element of cutting back on their own costs, and they keep having that conversation of increasing their cost, yet revenue is not coming forth, it's unfair. So there needs to be an element of, we cannot hold these people accountable. We have been shouting, but we're just getting to the point of, dear God, please might you touch these people? Might they feel that there is a responsibility to be accountable in terms of how are they also managing their budgets? So we need to get to a point of zero budgets. We certainly will not get there today, but there needs to be an element of how do you reorganize your own costs at the county level. I don't know whether the law allows you to do that, but it needs to be a human conversation that says, will I keep running this cost? No one knows when Corona is going to end. We thought we'd have come to the end of it this year, so we really do not know where it's going to come and end at. And then the final thing that I wanted to say, and this is your spiritual thought for the day, selfish ambition. I came across this in Galatians, where we talk about the fruits of the Holy Spirit. Before the fruits, there's an element of living a life based on your own personal needs. You know, and those people who live in that way, who are led by the flesh, selfish ambition, will actually ensure that they do not inherit heaven. We are a grossly religious community. There's always a church or a mosque somewhere. Selfish ambition comes in the form of, I want X, Y, Z. Money is released for COVID and I take it to do other things that are not the right thing. Or I'm supposed to provide something and I do it at a higher cost. When it comes to integrity and the morality of us as individuals, you might be praying every single day and walking around as a leader. I can guarantee you, these are not my words. These are the words of Paul in Galatians that say you will not inherit the kingdom of heaven. So in a nutshell, what I am saying, this leadership that we have today, this leadership where people have been crying and saying, listen to us. Our prayer is that, my God, touch your conscience, because by the end of the day, these decisions lie within you. As Mbithe, I cannot go and pound on the Ministry of Finance and say, please pay me because I have provided. So if we are going to take on debt, let us require or find a way of requiring that debt goes to pay for people who need to get paid who've provided services. And then secondly, take this situation and try and ask ourselves, either at an individual or leadership level, how do we slowly start getting to the point of cutting back on our costs and budgeting for what we have? And most importantly, let the leadership find a way of listening and saying, my goodness, I am representing people. The people I'm representing can't afford a meal. The people I'm representing are just not in a good space because there's so much going on. What can I do? Just one little thing based on the space of influence that I'm at.
Okay. Thank you, Reverend. I'm kidding.
You're welcome.
Daybreak will come back. Well, thank you for staying with Daybreak. We are on the tail end of the county puzzle. Let me see what you're saying online. Let's bring them up and see what you're saying here. Kiprono Abraham, the first one there, speaking to us on Twitter. He says, now that there are vaccines in the country, counties should partner with the national government and budget for vaccines. Mass vaccination will help us fight this pandemic. All right. Njenga Wakungu says it's good that the president intervenes in this issue of counties' funds disbursement. I don't think the treasury is doing us a good service. This is pure sabotage since it's common wananchi who is suffering. Counties are supposed to be the priority when it comes to funds. Okay. Mama Digital says common sense, but people have looted what could have saved lives and the country's economy. Now we are free falling in recession. Engineer Lazaro says county failures should be squarely blamed on the Senate. Good numbers of senators are busy parading themselves for gubernatorial positions and neglecting their core duty of oversight role. Kaka Bramzi says Kenya is not poor, neither is our counties poor. The problem is that Kenya is suffering from misappropriation of funds by some counties, if not all, demeaning economy. A country full of educated leaders but full of poverty of leadership. All right. That's what you're saying online. Let's take some final remarks here. I'll start with Honorable Sylvia Kasanga. Your closing remarks, and where do you go from here?
All right. Thank you, Trevor. As always, it's important to talk about money, public money, and use of public money, because the government itself has no money. It has to rely on the money that Kenyans give it in form of tax. And therefore, this conversation of accountability must be had and must be insisted on. And we know efficiency can only mean that you're being transparent. So we see a lot of cloud cover around expenditure of funds. And yet what we should be seeing is a lot of transparency. And that is why a lot of things are not efficient, because they don't want it to be transparent. And we must always insist on this. We must always push for this. Even as we go into another electoral cycle, this is a conversation that must always continue. And I have to really thank Mbithe today, the economist in the House. She has spoken very well and reminding Kenyans of the moral duty and obligation that we have. It is something we have spoken about many times. I have spoken about it on my platforms many times. And thank you, Mbithe, for that word from God. I feel blessed. I feel very blessed today. And thank you again for that. And finally, Trevor, let me just say to Kenyans that as we wait for vaccines to be rolled out more efficiently and faster, I just want to remind Kenyans, let us really look out for each other. This COVID is real. It's touching now everyone. Everyone knows somebody who's passed away. It's really affecting us in ways that will take a long time for us to recover, emotionally especially. And therefore, let us be cautious. By taking care of ourselves, we are taking care of our brother and our sister. And more importantly, let us also just reach out to one another. Let's be gentle and kind to one another. Let me just remind Kenyans, it's a tough time right now, even as we wait and grapple and bang our hands on the tables for what the government or what our leaders are doing or not doing. Let us just remember to be human towards one another as a way to even just begin to find some healing towards this. And thank you again, Trevor, for having me, and my panelists. Thank you for the wonderful conversation this morning.
Anytime. Be there.
Thank you so much, Trevor, and you're most welcome, Heshima Sylvia. It's nice to meet you, albeit virtually. My closing remarks are this. We need to speak about our country in a positive way. I've seen our comments here, some of them are negative. Kenya is a beautiful country. We are endowed with spectacular resources. The human resource talent in this country, a space where I was watching an ad for Coca-Cola online, and the lady is going to the river to fetch water. Her English is impeccable. She's saying, I have to wake up to go to the river. So there's an element of an investment in education that has been made by the government. Now, there's an element of responsibility for you and I, whether we are leaders in the government level, leaders in business, leaders in our households, to ask ourselves what's in front of us. We are well educated, we are well spoken, the government has invested in technology. Business models will not change, have already changed. It's not something that's only common to Kenya, it's happening globally. So, as you take time to pause, to reflect, to reprioritize, you're asking yourself, how will my source of revenue change? How will my business model change? But more importantly, we're very quick to speak, very slow to listen. We need to start re-engaging the people around us to understand where's the demand coming from, what do you want, how do you want it packaged, and then to leverage on who we are as a people and begin to sell. I think right now what we have seen people doing is moving from professional employment and offering consulting services online using Zoom and other platforms, and that's spectacular. But we have to now move to the other level and ask ourselves, what goods are we going to be able to produce and sell, and how will we engage with the likes of Dr. Hillary to find his oxygen and package it and sell it? Because by the end of the day, we should be in a country where LPG gas, the way it's in every house, every person who needs oxygen should be able to find it. So pause, reflect, reprioritize. You are the benefit, you are the asset in this country, but you can't be an asset if you don't have revenue and you can't feed yourself. Feed yourself, but most importantly, whether COVID-19 stays with us or doesn't stay with us, that's outside of our control. Control your mind, use this opportunity to rethink how to go forward, and I see such a wonderful and prosperous economy where we are all moving together. Thank you so much, and over to you, Trevor.
All right, Dr. Barchok.
Yeah, thank you, Trevor. I will pick up from where Reverend Economist earlier on. Particularly on where I think is the source of the problems that we are facing as a country, not only in terms of the weaknesses that we have noted, particularly in fighting COVID-19, but generally on the ills that are facing us as a society. And I want to agree with Lita that our problem is not that we don't have leaders, but I think we don't have leadership. So that is the main challenge that we have as a country, and we have to be honest with ourselves. Most of our leaders, as Bita has noted, have selfish ambitions. Whatever we do, at the end of the day, what I would want to see as a governor is what comes to me as an individual. In whatever intervention that we are putting in place, whatever programs that we are putting in place, what is coming to me? What is going to my family? And I think that is where we have the problem. And I was having some discussion last week with some people, and I was telling, I sometimes withdraw from my position and look at how we are running the country, how we are behaving as leaders, and sometimes you sympathize with the people that we are leading. Because as much as personally I want to do the best, and I've made a pledge to the people of Bomet. In fact, not once, not twice, but severally. I've always made an announcement that the way I will spend your money is how I would spend my own money. I would want to have value. I would not spend money because I just have money. I would negotiate and ensure that if it is possible for me to purchase something for 500 shillings instead of 1,000, I would save the 500 to do something else. And even the way I spend the money, the way I walk around. In fact, I travel. I normally use one vehicle. I don't use several where we have chase cars. I travel with very few people. Not because I don't have room to do that. I have. But if I can spend less money in fuel, that money will go to a dispensary, purchase of an equipment, or something like that. So I think what we need to do as leaders, as much as we have those privileges, I think we should empathize with the people that we are leading. And I think we should prioritize the needs of the people. And we also need to be honest with ourselves. Even when we are setting laws, sometimes you see the way we put policies in place, and you can easily interpret that so-and-so is trying to do this so that tomorrow there is something that comes to him or her. So that's what we need to do. Secondly, I think from the comments, people are emphasizing so much on mass vaccination. And I think it's very important that we note that vaccination will not prevent us from contracting COVID. The only thing is that it will do is to strengthen our system to respond. In case you contract the disease, your system will be able to fight. So I think what we should be emphasizing at the moment, and I think that to be, as much as we want this mass vaccination, I think we should also emphasize on mass testing. Mass testing is very important, and then we isolate and treat where possible. So I think we should not lose sight on that. Mass testing is very important, and we should invest a lot of money in that particular area.
All right. All right, thank you so much, Dr. Hilary Barchok, Bomet Governor, Honorable Sylvia Kasanga, nominated Senator, and Be the Mwema economist. Thank you for speaking to us this morning, and thank you for all your comments coming through.